Hello everyone, this is part 2 of lecture White and Red Lesions of Oral Mucosa. Today we will discuss oral hairy leukoplakia, oral keratosis, and oral candidiasis. Let's start with the oral hairy leukoplakia. The oral hairy leukoplakia is the most common HIV associated oral mucosal lesions. الكلام ده يعني شنو؟ يعني إنه most of the patients with HIV أنا بلاقي عندهم oral hairy leukoplakia as a significant sign. Oral hairy leukoplakia بنستخدمها as a marker of the disease activity. Okay, if oral hairy leukoplakia is found, so the disease is active and the virus is going on and progressing. Lesion associated with a low CD4 plus T lymphocytes count. Oral hairy leukoplakia is a corrugated or hairy يعني هو بيوصف لي from the name it's a corrugated أو شكلها زي الhairs from leukoplakia it's a white color, so it's a white lesion usually seen on the tongue lateral border, وده main characteristic بتاع إنه في most of the patients أنا بلاقيها on the tongue في lateral border, and it's found mainly in the HIV, AIDS and other immunocompromising states, ولكن هي most common HIV associated oral mucosal lesion. As a definition, it's a benign, well demarcated, generally asymptomatic. يعني patient ما هيجي يشتكي لي منها خالص، ممكن يجي يشتكي من شكلها أو من discomfort من الcorrugation بتاعها. White lesion of the lateral tongue seen in HIV infected or immunocompressed individuals. The prevalence هما بيقولوا إنها uncommon in the population, لكن هي common in the HIV patients. The age adults, males are affected more than females. The etiology بيقولوا إنه Epstein-Barr virus usually in the immunocompromised patients, especially in the HIV/AIDS, and the cases have been reported in the patients with the hematological malignancies or organ transplants. يعني بيقولوا إنه في role of the Epstein-Barr virus بالنسبة للناس اللي هم عندهم HIV or AIDS. تمام، والcase reported in the patient with the hematological malignancies أو اللي بيكونوا عاملين organ transplant اللي هم كلهم عبارة عن شنو immunocompromised patients. Okay, let's move to the clinical features. In the oral cavity, it may be flat or raised and is often thick and corrugated and frequently exhibit vertical ridge-like striations. يعني بتحس بقى زي الخطوط اللي هي ال hair-like appearance، وإذا كانت flat أو raised هي في الآخر بتكون يا إما thick or corrugated. The lesion cannot أهم حاجة فيها إنها cannot be rubbed off and distinguishing the condition from pseudomembranous candidiasis لأنها برضو بتكون في ال HIV patients إنها cannot be rubbed off. Extraorally ممكن ألقى lesions بتشبه الشكل بتاع ال oral cavity in the skin. Okay, أو في other mucous membranes بالذات في ال patients اللي هم with the immunodeficiencies. Here you can see the oral hairy leukoplakia of the right lateral of the tongue with the diffuse شايفين من هنا لغاية ورا خالص، وكاتب إنه this patient also has a prominent hairy tongue واللي هما unrelated to each other، لكن ما شاء الله patient لامي كل lesions together. Here you can see it's very clear إنه these are hair. تمام، شكله زي الhair. Hairy leukoplakia في a border of the tongue with a focal line near white plaque. طيب oral hairy leukoplakia is believed associated with the Epstein-Barr virus infection. طب هم قالوا كده ليه؟ قالوا كده لأنهم most of the patients اللي عندهم hairy leukoplakia لما عملوا لهم histopathology لقوا viral particles بتاعة الإبشتاين بار virus. and often seen as a precursor to development of an AIDS defining illness. اوكي يعني most of the patients اللي عندهم ابشتاين بار فيروس ده مؤشر خطير انه ممكن to develop an immunocompromised condition such as AIDS. Malignant potential has not been demonstrated and this is not considered precancerous رغم انها بتكون موجودة في patients with immunocompromised conditions ولكن هي is not a precancerous أو pre-malignant disorder. Diagnosis ما عندنا a diagnostic test ولكن ال diagnosis based on the clinical manner in the context with the HIV disease. يعني إذا لقيت patient عنده HIV فدي حاجة هتساعدني في confirming the diagnosis. Immune or HIV status should be ascertained if unknown. يعني إذا لقيت البيشنت ده عنده الهيري ليوكوبليكيا أو الأورال هيري ليوكوبليكيا I have to test for HIV for this patient لأنه ممكن زي ما احنا قلنا يكون hidden وإحنا ما عارفينه. Biopsy may be indicated to distinguish this condition from hyperplastic candidiasis or from the leukoplakia نفسها. Okay. Differential diagnosis أي white lesion تشبهها في الشكل can be a differential diagnosis such as frictional keratosis, lichen planus, tobacco associated leukoplakia and geographic tongue. If there is a treatment, no. Follow up just for observation. ولكن it's not a problem to to make a treatment for it. اوكي احنا قلنا ممكن patient يكون حاسس بالديسكomfort ولكن المشكلة اللي هتكون عنده هيكون أكبر من الأورال هيري ليوكوبليكيا. Just justify this for the patient and يعني discuss with the patient this is not a serious condition and it's not a pre-malignant lesion or it's a not pre-malignant condition.